I'm Professor Andy Peters from SEBI, Supporting Evidence-Based Interventions, University of Edinburgh. We're here on the fringes of the virtual World One Health Congress to discuss a topic that is probably at the heart of all our work, and that's data-driven One Health innovations, particularly in lower and middle income countries. And with me today are four of my friends and colleagues who work in this space in one function or another, most of whom have an animal production, animal science, animal health bias, I would say. I'm going to just introduce each one of you briefly, but then I'll ask you to sort of correct and embellish that probably a little bit. But first of all, I want to welcome Dr. Lois Muraguri, who's Policy Director for one of our sister organisations, GALVmed, and who's worked in this area of policy in relation to international animal health for a number of years. So welcome, Lois. Thank you for joining us.
Thank you.
Secondly, I wanted to welcome Professor Mizeck Chagunda and also congratulate him on his new appointment as Director of the Institute of Tropical Agriculture in University of Hohenheim. So welcome, Mizeck, also.
Thank you very much, Andy.
And thirdly, Professor Appolinaire Djikeng, who again is Director of Sister Institution, Centre for Tropical Livestock Genetics and Health. You'll see the logo in the background there, which is an organisation in partnering between University of Edinburgh, Roslin Institute, SIUC and ILRI, focusing on genetic aspects of improvement of animal production, animal health in lower and middle income countries again. And last but not least, Dr. Sam Thevasagayam, Samuel Thevasagayam, long-term friend and colleague of mine, who is Deputy Director of Livestock at the Bill and Melinda Gates Foundation, who I'm very grateful to for supporting SEBI over the last few years. So with that, I'm going to invite each one of you to say a little bit more about yourselves if you wish, but in particular, how you think your own work relates to this issue of One Health, and particularly focusing on the data availability aspects. And perhaps I could ask Mizeck first.
Thank you very much, Andy. This area of talking about data is really central to most of the things I do. Having been trained as a quantitative geneticist, that all really goes around data. And now working in the broader area of animal breeding, the broader area of the contribution of livestock to livelihoods and all that kind of contribution, data is really very central to what we do. So thank you very much for inviting us to be part of this panel discussion.
Okay, thank you. Yes, Appolinaire, please.
So thank you, Andy. Hello, colleagues. I'm very happy to participate in this discussion. Thanks for the introduction, Andy. The center that I lead is really focusing on genetic improvement, and that relies heavily on data to set a benchmark, but also with time measure progress that you are making. And I think this conversation is extremely important for us even to look at the food system in general. So really pleased to be part of this.
Thanks. Thank you, Appolinaire. And Sam?
Why data is important, as most of you will know, Gates Foundation is relatively a newcomer in the development sector, and particularly in agriculture and livestock. And what we wanted to do is not just jump on the bandwagon, but really look at the evidence base and really look at the data to see what interventions we could make or we could contribute to that will enhance or accelerate the improvements that we can make in LMICs. And that is why we use and we really spend a lot of effort and time to work on gathering data and inform our decision, not only the investment decision, but track the progress we are making. Because one of the dangerous things that we could do is, while the intent is to do good, it's easily, we might harm people inadvertently. So it is in order to decide where we go, as well as to monitor whether we are helping or hindering, data becomes a core, anchors us to make decisions. So that's why we pay a lot of attention and importance to data. Thank you.
Thank you very much, Sam. Lois, could I invite you to just make a few introductory remarks, please?
Thanks for inviting me to be part of this panel. I work at Global Alliance for Livestock Veterinary Medicine, as Andy mentioned at the start. And part of what GALVmed does is work with partners to improve the livelihoods of smallholder farmers in low and middle income countries. So the availability of data to inform the interventions that GALVmed is going to be involved in is very central. And I would also add that part of what we do is work with the pharmaceutical industry and linking them to the lower and middle income countries, the markets there. So obviously being an intermediary and looking at the information and the marketing information and data that would be used, that would be of use to the pharma industry is essential for GALVmed's work.
Okay, thank you very much, all of you. I just wanted to move on now to raise a couple of other questions. So it's interesting, actually, that this conference, I guess, couldn't have been at a more kind of appropriate, sadly appropriate time in relation to the COVID-19 pandemic. And it's actually brought a lot of issues to the fore, in my mind anyway, that are relevant to our interests in livestock. And I wanted to ask you whether you think that the current pandemic has influenced what we do in relation to international efforts on livestock and the need for data. Appolinaire, can I ask your opinion on that, please, first?
Yeah, thanks, Andy. I think it doesn't matter where you are or where you have been in the world, whether you're in low and middle income country or in advanced economies, we've seen a major disruption caused by COVID-19. And I think from the work that we collectively do here, we see that the impact has been really profound when it comes to low and middle income countries. And I just want to share my views from the food system. We've seen that the food system in low and middle income countries is very weak. There was no way to plan and understand, what are the numbers and what's needed in terms of localities, and even plan for creating, situations where some of the food shortages could be addressed. I think it speaks to the absence of data. And also looking at how we are promoting and supporting, smallholder producers. A lot of that must be connected to market, and production has to be really calibrated to the market. And for you to do that, you rely on the numbers. In the context of One Health, livestock is always blamed to be the great incubator for the passage of some of these zoonotic infections from the animal population into the human population. And for that, we have to create good incentives to be able to monitor what's flaring up, even including in remote areas. But back to your question, I think the major disruptions have been there. How do we address that? And I think there's some innovations on better ways of collecting data. You don't have to always go to survey each farm to get the information. And the incentives that you can set up for smallholder farmers to be giving you data, because they have in return, they will be collecting something. And that helps you at least to be monitoring, to be, providing support, and also responding in real time as soon as something dangerous, I should say, comes up. Thank you.
Okay, thanks. Mizeck, please, if you could.
Now, one of the things that really this pandemic has shown us is that the importance of data is not just for scientists. It has actually shown us that data and the information generated from data is very vital for our day-to-day lives, not only in agriculture, but even in the normal day-to-day consumption of things. So getting back to that question on how this pandemic has really revealed some of the things we took for granted, the making decisions based on information which is generated from data has been very vital. And also, one of the things, at least from a German point of view, that this pandemic has shown us is that science develops. So knowledge develops as more data is coming in. And we've seen that from the beginning of the pandemic with some of the recommendations that were made, and the recommendations that are made now are completely different based on how much data has been generated. And that lesson is to be learned even in the agricultural world, that we need to evolve our knowledge based on data. So the pandemic has really shown that data is not static, it's a dynamic system, and our knowledge develops as we get more data, and then we can even make better decisions, if I may call them that.
Okay, thanks for that. It's interesting, the note you just finished on there, and then we can make better decisions, because that's what I wanted to move the discussion on to, really. And we talk a lot about data for decisions making and the critical needs of data for policy making, etc. And actually, it was an issue raised at our last LD4D meeting in Rome in February, when someone asked the question, well, you know, even if we produce all this data, do the policymakers really want it? Do the decision makers really want it? And if they say they want it, do they really use it? Do they really need it? And I wanted to just sort of get your views on that question, starting with Sam, really, to see what the views would be in the Gates Foundation, for example.
Sure. Thank you, Andy. That's a really important question. There's no, as we have already established, the need for data for decision making, policy making, it's a fact. However, when it comes to, at least sitting where I sit, the Gates Foundation, and working with multiple governments and multiple partners that we work with, what I think, the policymakers do need data, but not necessarily more data. But what we are missing, in my opinion, is the context in which we provide the data and the format in which that we generate data and analyze the data. That's where the disconnect, I believe, exists. Because we never, we are very bad at going and asking the real policymakers, what exactly, what data you need, in what format, and why, and then do the analysis accordingly. And we as a global community, we fail on that. We are driven by our own interest, intellectual interest, scientific interest, but not necessarily looking at the data from the person who has to make those decisions. And that is where that gap needs to get filled. And we need to generate, analyze, and provide the data in a fit for purpose manner for each decision maker, policy maker. And until we get that, lots of data gets collected and gets published and sits on shelves. That's where the problem is, I think.
Yeah, okay, thanks. I see that. Lois, I wanted to bring you in here because obviously, as policy director at GALVmed, this must be something that you would have a definite expert view about, really.
Yeah, in addition to what Sam has said, which I think is an excellent point, I think I would progress that even a little bit further and say that we shouldn't assume that once data is provided, that's enough. once the information is provided or the data is provided to the policymaker that is appropriate, then working in partnership with them to see what solution can be made or what appropriate intervention can be made for that. We find oftentimes that we are all, as the scientific community or different organizations, we're interested in a certain outcome, but often we are providing data in a sort of disjointed manner, or even interacting with the policy decision makers. It's not a coherent way of interacting with them. So we need to also get organized and work together and see, okay, what is it that we need to support the decision makers in their decision making using the appropriate information and data that we have collectively worked together to provide them.
Okay, thanks for that.
So Andy,
sorry, Appolinaire, yes.
I think the point that Sam and Lois made is extremely important, not just necessarily for data, but for other interventions. Even the way we design our science, for scientific outputs, we have to be generating the information that is needed by somebody. Because I think just saying that we have a lot of data, we'll put it on the table for the policy makers to adopt it. It may just be very important data, but only from our perspective. So even for the collection, what kind of data are we collecting? Where are we collecting? Within what time frame can we deliver those things to policymakers? I think it's a general point that we can use as really blueprints on how we design our interventions, including the high-end science for supporting, activities in low and middle income countries.
Okay, thank you. Something else for me that's been very much in the public eye and has struck me about the parallels with the kind of work we do was in relation to getting consistent data and being able to compare data sets. And one of the things that arose just a few weeks ago in the UK for certainly was the difficulties just in calculating mortality rates, fatality rates due to COVID. And it turned out after several weeks of reporting that the different nations within the UK were effectively all doing it differently. So you couldn't compare the results between England, Wales, Scotland, Northern Ireland, etc., with any degree of kind of accuracy or confidence. And it just highlighted some of the deficiencies that even the people who are supposed to be experts can't really do it all that effectively. And we heard a lot in here about following the science and so on, but you begin to wonder, well, whose science is it we're following? And it turns from being a very objective thing supposedly to being not that at all. It's quite subjective at the end. But I digress slightly. I just wanted to probe a little bit your views about that and whether we encounter similar data challenges in terms of inconsistencies in the way people collect data, the way they interpret data, and the way they use it and communicate it in the livestock sector, really. Who shall we start with? Sam, maybe, because I think it's something you probably experience quite a lot.
Technical challenges we can overcome, but when you combine it with politics, that's the issue. And that is important for us when we talk about data. Oh God, this is absolute no-brainer. The country should do X, Y, Z in order to drive their livestock development. But one of my former colleagues told me, don't ever underestimate the politicians. They know exactly how to do it, but the current situation is there because there is a rationale behind that. Some objective is being fulfilled. Until and unless we understand that and then figure out how we could influence that decision making based on factual data and be helpful, we'll be we'll be doing things that are not necessarily action at a country level. Although intellectually and rigor-wise, it will be factual. It may not be of any use or of value in terms of utility. So that's where we need to, that is why the world remains, these problems that we are trying to tackle continues to remain a problem. If it was easy, just data and fix it, then we could have done it long time ago. So that's where we need to have that humility and empathy and understanding to navigate through that difficult area and make ends meet.
Lois, thank you, Sam. Lois, could I ask you what's the kind of perspective of a policy person? How do you see this in terms of consistency?
Yeah, I think one of the things that we probably need to appreciate is that from a policymaker's perspective, there's probably a lot of other competing interests. So, we're not just looking at, if we have the Prime Minister standing there, he's also trying to balance the economy and sort of the public health angle as well. So, and often I think when we are, as the scientific community, presenting data to policymakers, sometimes we're not really looking at the other things that will influence their ability to, how quickly and enthusiastically they are going to take on the information that is on offer. So understanding, I think some obviously mentioned that the politics behind it, and some of the other very real issues around, just trying to balance, a whole system. And then just coming back to what you said about inaccuracies of data and sort of data can't be compared across different regions. And it's actually really telling how in human health and public health, as with the COVID-19, even with that, which is arguably more advanced than livestock, there is still quite a lot of discrepancies regarding data sources, regarding ways of measuring, and so on. And even when that information is presented, the policy options are also, quite different depending on who's taking the decision. So I think a wider understanding, I would say, of the entire environment, and working with others who are, also trying to influence and the decision making, I think is probably a better way to go than just assuming that if you provide the data, that's the end of the discussion.
Okay, thanks very much, everyone, for those comments.
I think this issue of data quality is really important. Sam earlier on talked about the gap in terms of the client and the producer of data. We don't really kind of, as scientists, sometimes define who is really looking for these data and what kind of information are they looking for. To a certain extent, this data quality issue comes from there. Because we are, as scientists, collecting data that are not really matched to the needs on the ground. And it's not just the quality, it goes back to the definitions as well. We need to have not only good quality data, but well-defined phenotypes. So defining the phenotypes, how do we measure those phenotypes? Then moves back to now we can measure what we want to measure. The problem has been this mismatch between where the data are generated and the client at the end of it. At the end of the day, the two are not talking to each other, which leads to a lot of data of poor quality.
Yeah, okay, that's very, very important, and thank you for raising that. In fact, just as you came in there, I just wrote the word quality down in my notes because I realized we hadn't quite covered that. And I think the whole aspect of quality and consistency could be the subject of another lengthy discussion, but it's a little bit out of the current scope, but we have to draw it to a close now. I'll just try to summarize 3 or 4 points. It will be a fairly inadequate summary because we've covered a lot of ground in a very short time, but in relation to the future needs, Appolinaire in particular drew attention to likely food shortages as this pandemic progresses, and that data on productivity will become increasingly important. But and then Sam in particular talked about it's not necessarily about more data, but it's about the context of that data, the way it's presented and communicated is also important. In the final comments, it was about consistency and the quality, which Mizeck, you've raised. And Lois raised a point, which I'm glad she did, that data is just one piece of the matrix that policy makers have to consider. It's one factor in there. It's an important factor, but it's not the only consideration, and we have to remember that. So I want to thank you all again for joining this discussion. It's been very informative for me, and I think we'll close it there. Thank you once again.
Thank you, Andy.
Thank you. Thank you very much.
Thank you, Andy.